Okay, so we're going to go over 3 main neural tension tests for the lower leg. So we're going to go over tibial nerve, posterior tibial nerve, sural nerve, superficial peroneal. So usually I always start with the hamstring measurement first. So I want to take them into passive knee extension as much as possible. So I'm going to support under the Achilles. I'm going to get on top or superior to their patella. I'm going to make sure I lock them out in terminal knee extension, and then my instructions to the patient are, let me know when you feel a stretch, and I guide them and say it could be in their lumbar spine, their glutes, their hamstring, popliteal space, gastrocsoleus, all the way down to their foot. So the first measurement we'll do is locking them out in terminal knee extension, making sure this foot is plantar flex as well. We want to slacken the nervous system tissue as much as possible. I'm going to take them up slowly. Patient's going to say, oh, I feel a stretch there. I'm going to maintain under the Achilles. I'll turn this loose. I'll grab my bubble inclinometer or my iPhone, put it on the bony part of the tibia, and again, making sure they're locked out in terminal knee extension. That little flex will mess with your measurements. So now that we have hamstring, let's go on to posterior tibial nerve. So what we want to do is manipulate the ankle to make sure we're taking up all the range of motion there. So to bias that posterior tibial nerve, we're going to dorsiflex and evert with the single leg raise or the straight leg raise. So while I'm here, I'm going to take my forearm, I'm going to cross over the tibia. I've got him locked down here. Same supporting position into the Achilles, locked out at the knee as well. Now I'm going to instruct him and say, let me know when you feel a stretch. We're going to go up. As soon as the patient indicates they feel stretch or symptoms, I'm going to back off the ankle, put it into plantar flexion to decrease the neural tension. Now I'm going to measure again. So for the superficial peroneal and the sural, the only difference is you're going to reach across because we want to add that adduction component to make sure we get all that neural tension out. So for superficial peroneal, I'm going to reach across, same diagonal movement with my forearm. This time I'm going to stabilize as calcaneus, and we're going to invert it and plantar flex to get superficial peroneal swooping around the front. So same instructions to the patient. This time I might indicate you may feel some stretching sensation on the anterior aspect of your tibia or the dorsum of your foot. I've got him locked down here, supported, again, locked in terminal knee extension as well, taking up all the slack. I'm going to slowly raise up, and I'm going to come across his body towards me until he indicates he feels a stretch. Perfect, and again, back off that neural tension, maintain. We'll get our measurement here. Lastly, we'll do sural nerve. So the only difference between sural and superficial peroneal is that we want to maintain that calcaneal inverted position, but this time let's dorsiflex the foot instead of plantar flex. That way we're getting that lateral band here. So again, same mechanics on everything else. I'm going to dorsiflex and let's invert that calcaneus, and we're going to bring it across our body. He's going to let me know when he feels that stretch. Perfect right there. Back it off again. Maintain. Measure.